Hello everyone. Today we'll discuss about the hypoglycemia in diabetes mellitus. As we know, this hypoglycemia is one of the metabolic complication in diabetes. So about this we'll discuss in three parts. So let's start about this about its first part. So how this hypoglycemia can be defined? So as we know, this hypoglycemia or low level of blood glucose is very common in diabetes, and this hypoglycemia is defined as a clinical state with low plasma glucose concentration, and this low plasma glucose concentration is usually associated with the signs and symptoms of autonomic hyperactivity and neuroglycopenia. Autonomic hyperactivity is a condition when there is arousal of autonomic nervous system. Basically, it's a sympathetic nervous system part, and this causes for generation of some physiological symptoms. Those are anxiety, fever, dry mouth, sweating, palpitation, etc. And neuroglycopenia is a condition where there is low level of blood glucose in the neuronal tissue like brain tissue, and due to this various symptoms are present in the person. This hypoglycemia interferes with the treatment of the diabetes, as well as this produces some serious effects in the patient. And it has been observed that this condition of hypoglycemia is very common when we are treating any diabetic person with insulin and sulfonylurea drugs. Usually, no absolute value of blood glucose has been defined to level as hypoglycemia. However, this condition of hypoglycemia ranges from 50 to 65 milligram per deciliter. As per American Diabetes Association definition, the level of blood glucose when goes below 54 milligram per deciliter, such condition is known as significant hypoglycemia. And to define alert value for hypoglycemia, a threshold of 70 milligram per deciliter has been earmarked. In a patient with diabetes, the condition of hypoglycemia can be defined by the Whipple's triad, and this Whipple's triad was coined by one of the scientists, Alan O. Whipple, and it was to diagnose the insulinoma like condition. So what are the three parameters of this Whipple's triad? The first one is the person should have symptoms of hypoglycemia, and second parameter is that we should document this level of hypoglycemia by measuring the blood sugar level. And the third one is whenever we are providing such a person with carbohydrate, the person relieves from symptoms of hypoglycemia. So this is known as Whipple's triad to diagnose a condition of hypoglycemia in any diabetic patient. Let's discuss what is the normal physiological response against the hypoglycemia in the body. So as we know, the glucose is the primary source of energy for brain tissues, and we should also know that these brain cells, they neither synthesize the glucose, they nor store the glucose. So it's totally depend on the other organ and tissue for the glucose. If there is any fluctuation in the blood glucose level, so it will directly affect the brain. And whenever there is a low level of blood glucose, or whenever the blood glucose level it starts falling, the body starts a series of physiological changes to recover this, to restore this, and all these physiological changes that helps individual to sense this condition of hypoglycemia, and ultimately the person takes some corrective action against this hypoglycemia, and for that he consumes the carbohydrates. So what will happen when this physiological response doesn't work? So if this physiological response will not work, the counter regulatory hormones response, which is towards the correction of hypoglycemic like condition, then blood glucose level will getting fall, and the level goes below the critical value, and this level of glucose below the critical value, it starts producing some cognitive function impairment, and this is depicted in the person in the form of development of confusion, and person can go on the coma like condition. But in normal healthy individual, such corrective action against the severe hypoglycemia is functional, is normal. But what happens to the person if he is having diabetes or a person is not normal? So in such patients, when there is hypoglycemia associated autonomic failure, in such condition, against the hypoglycemia, no decrease in the insulin to correct the hypoglycemia like condition, there is no increase in the glucagon hormone. So this will generate a condition known as incident hypoglycemia, and this will lead to reduced sympathoadrenal response to hypoglycemia, and this reduced sympathoadrenal response will lead to reduced sympathetic neuronal response, and because of that there will be one condition which is known as hypoglycemia unawareness. Means person is having hypoglycemia, but the person is not aware about his condition of this hypoglycemia. This against this reduced sympathoadrenal response will lead to reduced epinephrine response, and because of this reduced epinephrine response, the defective glucose counter regulation will be developed, and ultimately both this condition will lead to recurrent hypoglycemia in such person. So let's discuss how this physiological response against hypoglycemia in any normal individual works. Whenever the blood glucose level goes around 80 to 85 milligram per deciliter, the first defense mechanism which starts against this low level of plasma glucose is reduction in the insulin secretion, and after that there will be release of counter regulatory hormones. If the level of blood glucose goes below and reaches around 60 to 70 milligram per deciliter, there is increase in glucagon secretion, which will the main function of this glucagon hormone is to increase the level of glucose in the body, and as well as apart from that there will also be increase in the epinephrine and norepinephrine hormones. So this increase in glucagon hormone, it will work on liver, and this will increase the gluconeogenesis and glycogenolysis process. Gluconeogenesis is production of glucose by using proteins and fats, and glycogenolysis is the depletion of glycogen and production of glucose from it. However, this epinephrine, it works on liver as well as is also acts on the adipose tissue, and this promote this adipose tissue for lipolysis, that is depletion of lipids, and this epinephrine will also work on skeletal muscle to induce the proteolysis, depletion of protein, and glycogenesis means production of the glycogen. Apart from that, glucagon and epinephrine, if there is prolonged hypoglycemia, then cortisol and growth hormone will also be activated. When this blood glucose level goes much below between 50 to 55 milligram per deciliter, the person starts showing the symptoms which are related to the neurogenic symptoms starts when the level goes below the 50 to 55 milligram per deciliter. The whatever counter regulatory response we have discussed in previous slide, same has been depicted in the picturesque form in this. So here we can see that the liver starts gluconeogenesis by using lactate and alanine and starts producing the glucose, and as well as there is glycogenolysis, and all these effects are due to the hormone glucagon and epinephrine. Apart from that, the epinephrine works on adipose tissue and it promotes lipolysis. This epinephrine also works on the skeletal muscle and this promotes for proteolysis. Let's discuss about the classification of hypoglycemia given by the American Diabetes Association. So level 1 hypoglycemia is the condition when the glucose value is less than 70 milligram per deciliter, and it is also known as alert value, and this alert value is for the therapeutic dose adjustment of the glucose lowering drugs, and this often related to the symptomatic hypoglycemia, means the person starts showing the symptoms of hypoglycemia. The level 2 hypoglycemia is also known as clinically significant hypoglycemia, and again the plasma glucose levels are less than 70 milligram per deciliter. The level 3 hypoglycemia is known as severe hypoglycemia, and it is a condition when the person requires assistance by some another person to correct his hypoglycemia by administering the carbohydrate or glucagon. The next is documented symptomatic hypoglycemia. It means here the person shows the symptoms of hypoglycemia as well as these symptoms as well as we can document this hypoglycemia by measuring the plasma glucose value, which suggests the value less than from the normal value of the glucose. Asymptomatic hypoglycemia is a condition when person is having low level of plasma glucose, but still the person doesn't show any kind of symptoms. Next one is probable symptomatic hypoglycemia. Here there will be symptoms of hypoglycemia, but these symptoms will not be accompanied by the level of plasma glucose which are very low and which are usually caused by the low plasma glucose levels. Relative hypoglycemia, when there are typical symptoms of hypoglycemia is present in any person, but the level of plasma glucose, it doesn't suggest that person is having hypoglycemia. So overall the classification of hypoglycemia can be presented as the level 1 is hypoglycemia alert value when the level of glucose is less than 70 milligram per deciliter. The clinically significant hypoglycemia when the glucose level is less than 54 milligram per deciliter, and the severe hypoglycemia is the condition when there is change in the mental status of the person and the change in the physical status, so that the person requires assistance by some another person by providing some carbohydrate or glucagon. Let's discuss what is hypoglycemia alert value. So as we have already discussed that as per the American Diabetes Association guidelines, when the level of glucose goes below 70 milligram per deciliter, it is known as hypoglycemia alert value. And why it is known as alert value? Because it generates an alert to adjust the therapy of such person, and it also requires treatment with the fast acting carbohydrates. What is clinically significant hypoglycemia? When the blood glucose level goes below 54 milligram per deciliter, and this can lead to some serious effects, like it can produce fall in the person, and also it can produce some kind of injuries in such person. The severe hypoglycemia is the condition when there are severe cognitive impairment, and because of that the person requires assistance of another person for the recovery, and this severe cognitive impairment are due to the change in the normal cortical or intellectual function of the person due to low level of plasma glucose level. This severe hypoglycemia is a diabetic emergency like condition, and in this, as the person cannot recognize his situation and he is unable to recover himself by the eating, and this severe hypoglycemia is very common in such person who are taking insulin and other anti-diabetic medications. So what are the conditions which can cause the severe hypoglycemia like condition? If any person who is on treatment with insulin or other medication can generate severe hypoglycemia when the person misses or delays his meal, there is overdose of insulin, or there is miscalculation of insulin, and because of that there is overdose of the insulin. If any person does any strenuous exercise, which is also reason for producing the hypoglycemia, and apart from that the person doesn't lowers the medication level, so both this condition will add on the condition of hypoglycemia. Alcohol consumption itself causes the hypoglycemia like condition, and person has no awareness about the condition of hypoglycemia. What is the hypoglycemia? What are the symptoms of hypoglycemia? So these are the some causes of severe hypoglycemia. Let's discuss what are the symptoms of hypoglycemia. So person can loss of his consciousness, confusion can be there, seizures may also develop, there will be slurring of speech in the person, he will feel hungry, sweating will be there, clumsiness can be there, and it can also lead to death of the person. Here is the classification of the symptoms of the hypoglycemia as per their sympathetic involvement, their neuroglycopenic involvement, and there are some unusual symptoms of this hypoglycemia. Thanks for watching this video. For further details, please follow the second part of this video.